Guaranteed. Good afternoon, everyone. Glad to see you all here. I'm joined by two of my wonderful colleagues from the House, Senator Cardin and Senator Van Hollen, both from Maryland. I'm Mazie Hirono from Hawaii. So let's just get started with this press conference. During the campaign, President-elect Trump promised not to privatize Medicare or cut funding for Medicaid. Today, we are giving Senate Republicans an opportunity to reaffirm this promise to the American people. But I am deeply skeptical that the Senate Republicans will not do the right thing because they are committed to repealing the Affordable Care Act. Senate Republicans have, for years, fought to repeal the ACA, the Affordable Care Act, which would drastically cut Medicare and Medicaid funding. And the president-elect's nominee to serve as Secretary of Health and Human Services is the architect of the Republican plan to privatize Medicare. The assault on the ACA is an assault on Medicare and Medicaid, and both of these programs can be dismantled using the budget reconciliation process. Dismantling Medicare and Medicaid would leave nearly 600,000 people in Hawaii without the protection of these important social safety net programs. This is completely unacceptable. That's why I, along with my colleagues, are fighting tooth and nail against any effort by Congressional Republicans and the president-elect to harm Medicare and Medicaid. I'm fighting for people like Anna and Lanny Bruder from Kauai. Lanny is already 80 years old, but he's still working 3 jobs to make ends meet after losing their family home during the 2008 mortgage crisis. Anne has glaucoma and pays what she calls a ridiculous amount for eye drops. Lanny survived a heart attack and has 2 artificial knees. They simply could not afford the extra $6,000 a year their health care would cost if Republicans succeed in privatizing and voucherizing Medicare. I'm also fighting for young people like Anne, another Anne, who walked into the Kokua Kalihi Valley Clinic 3 years ago, and she had no insurance and learned that she was pregnant at the age of 15. The doctors at the clinic helped Anne apply for Medicaid, which helped her afford prenatal care and encouraged her to stay in school. With these resources, Anne and her new husband, Dan, age 17, welcomed a healthy baby boy named Joseph into the world. Today, Anne is a graduate of Farrington High School, works part-time, and has plans to become a pediatric nurse practitioner. Anne, Dan, and Joseph now have insurance through Dan's employer. I share these stories, and there are thousands of similar stories in Hawaii because they demonstrate how important Medicare and Medicaid are to millions of people across the country. This is why I've introduced an amendment with Senator Donnelly and 28 of our colleagues that would protect Medicare and Medicaid from devastating changes through the budget reconciliation process. The Hirono-Donnelly amendment would require a supermajority to privatize Medicare or increase the eligibility age for the program. It would also require the same supermajority to reduce state funding for Medicaid from current levels. Passing this amendment would send a clear message to seniors and working families that Congress is serious about protecting their access to quality, affordable health care. And of course, I encourage all my colleagues to support the Hirono-Donnelly amendment when it comes up for a vote later on this evening. And now I'd like to turn to Senator Ben Cardin of Maryland for his remarks.
Well, Senator Hirono, first of all, thank you for your leadership on this very important issue. This issue is to protect our Medicare and Medicaid population. And it's very interesting, the very first bill that the Republican leadership is bringing up in the 115th Congress is a legislation that jeopardizes both Medicaid and Medicare and those who are the most vulnerable. Now, there are a lot of things we could say about the repeal of the Affordable Care Act. There are a lot of vulnerable people who are going to be put at risk. Senator Hirono mentioned a couple of her constituents. I could go through so many letters that I've received from individuals. One's is a student at Towson University, that the only way she could get affordable health coverage is she could stay on her parents' policy to age 26. Well, that's gone under the repeal of the Affordable Care Act, and we don't know what comes next. Or I could talk about a single parent family where her child has congenital heart disease. And when you eliminate the cap, that we allow caps to come back in the policies, she won't have adequate coverage to cover her child's health care needs. She may have to go into Medicaid, but then Medicaid may be cut back. And without the Hirono Amendment, that's at jeopardy. So vulnerable people are at risk as a result of the repeal or attempt to repeal and not replace the Affordable Care Act. It affects, in my state, about 400,000 Marylanders who get their health insurance directly through the exchange or the expansion of Medicaid. But it actually affects over 2 million Marylanders because their health insurance policies won't be covering what they were covering before, all which puts them at great risk. So we have in our Medicare expansion, Medicaid expansion, we have over 200,000 that have been covered in the state of Maryland. That's at great risk. The Hirono Donnelly Amendment would say, look, let's make sure that we at least have a 60-vote threshold if we're going to make that type of a fundamental change in coverage for the most vulnerable people in our community. We have to make sure that those who cannot speak out for themselves are represented in this debate. And the way this is going forward with using reconciliation, using the budget process, not telling us what's coming next, it's outrageous, and people are going to get hurt. And we're going to stand up to protect those who are the most vulnerable, our Medicaid population. And Medicare, we've seen under the Affordable Care Act, there's been significant improvement. We're closing the so-called donut hole that allows seniors to be able to get their prescription medicines. So many times before the passage of the Affordable Care Act, how many times do we hear about seniors who left their prescriptions on the pharmaceutical counter because they couldn't afford the payment? We're going to go back to those days. The Hirono Amendment will help make sure that that doesn't happen, and we'd urge our colleagues to support that. We also know that it's going to be more costly for seniors on Medicare. We know that the solvency of Medicare is affected by the repeal of the Affordable Care Act. All that is bad news for the Medicare population in Maryland and our nation. The Hirono Donnelly Amendment would help us protect Medicare, Medicaid, and our healthcare system, and I'm proud to join her in this effort. And there can be other amendments that we're going to file that we hope Republicans will join us if they are going to live up to their commitment to protect America's most vulnerable.
Thank you, Senator Cardin. We've been joined by Senator Jeff Merkley from Oregon. Jeff, if you could step up and give your statement.
Certainly. Well, it's a pleasure to join Senator Hirono and Donnelly in the Hirono-Donnelly Amendment. In my town halls, I've heard one devastating story after another over the years regarding health care. Individuals who said they could only afford one of 3 prescriptions, so they'd ask their doctor which one is the most essential. Others who talked about taking the pill that they're supposed to take and cutting it into quarters, hoping that at least a portion of that pill would be helpful, but they could only afford a quarter of the price. But perhaps the most devastating stories I heard were from individuals who came to my town halls and said, Senator, I'm just trying to stay alive until I can get onto Medicare. Please protect the Medicare program so it will be there when I turn 65. Well, this is a powerful issue in healthcare in America, the safety net we've provided for our seniors, this intergenerational contract that you will have peace of mind in your senior years that the health care you need, quality and cost, you will be able to access that health care. And that's in jeopardy. And that's why this amendment is so important. It's also why President-elect Trump campaigned against changes to Medicaid and Medicare. He made a big point about saying he was not going to cut these programs. So what we need right now is a tweet from our President-elect saying, I mean what I said, support the Hirono-Donnelly Amendment. We're all waiting. We need to have that type of consistency, conviction, and willingness to stand by a campaign promise because in this case, it affects the quality of life of millions of Americans.
Thank you, Senator Merkley. And now, Senator Van Hollen,
Thank you.
Maryland.
Thank you, Senator Hirono, and I'm here to also support the Hirono-Donnelly amendment. Thank them for offering it. Great to be here with Senator Merkley and Senator Cardin and others. I'm going to start by reading a tweet that was sent out at 11:38 a.m. on May 7th, 2015. At Real Donald Trump, I was the first and only potential GOP candidate to state that there will be no cuts to Social Security, Medicare, and Medicaid. Huckabee copied me. We want to make sure that the Republicans in the Senate copy President-elect Donald Trump's statement and copy what the incoming president said was going to be his policy. And they're going to have a chance to do that when they vote on the Hirono-Donnelly amendment. Because what a lot of people don't know, and they're going to be in for a very rude awakening, is that when you get rid of the Affordable Care Act and destroy the Affordable Care Act, you hurt the 30 million Americans who get their access to health care through the exchanges and through extended Medicaid. And that is bad enough. You're also going to be hurting tens of millions of other Americans who may not realize that they're benefiting from the Affordable Care Act. We have close to 1 million seniors in Maryland who are on Medicare. And they will see their costs go up right away in 3 and probably 4 ways. First, they're going to end up paying higher Part B premiums because the Affordable Care Act helped reform the Medicare program, reduce the costs of Medicare without harming any patients. And the amount that patients pay in their Part B premiums depends on the total costs of that program. So when we reduced the costs, we reduced the amount seniors will pay in Part B premiums. Those premiums are going to start going up right away. They've been seen very small increases for the last 5-6 years. Prescription drugs, we already talked about, they're going to reopen up the prescription drug donut hole. Under the Affordable Care Act, seniors on Medicare don't pay for cancer screenings, diabetes screenings, and preventative health care screenings. They're immediately shelling out more money for that. And finally, if you look at the House Republican plan, which Senate Republicans have supported in the past, it was designed first by the Speaker of the House, Paul Ryan, and then by the soon-to-be, the recently nominated Secretary for the Department of Health and Human Services, Mr. Price. I know because I've been the senior Democrat on the Budget Committee, first with Paul Ryan and then with Dr. Price. And their plan, as Senator Hirono said, will voucherize Medicare. And it will put the costs and risks of rising health care premiums onto the backs of seniors on Medicare by giving them a voucher that doesn't keep pace with the costs. And in addition to hurting the folks on the Affordable Care Act with extended Medicaid, they talk about cutting $1 trillion from Medicaid around the country and putting at risk people on disabilities, people in nursing homes, as well as those who get health care through Medicaid. So this is a very, very serious issue, and we're hoping that Senate Republicans will stand with the incoming president, at least on this issue, at least as he stated it in his tweet, where he said he would not cut Medicare and Medicaid. He asked Huckabee, he said Huckabee copied him. Let's make sure that the Senate Republicans do the same. Thanks.
Thank you very much. Do you have any questions, any of you? We have a couple of minutes. Yes.
I'm curious if any of you are participating in the speeches on the floor later tonight that Democrats are holding, and what you want to achieve with these kind of late night speeches that you're holding.
Well, I personally will be making my remarks relating to the amendments, so I'll be on the floor a little bit later. I know that there will be a lot of Democratic senators who would be participating tonight. Any others?
I may be joining them. I made a fairly long speech on Thursday night on this topic on the floor of the Senate.
Somebody had a question there.
I'm curious if, beyond the health care amendments, do you expect Democrats to offer amendments on other topics on the budget to sort of force some interesting votes during the vote around environmental energy issues, for example?
Either one of you? I think some of these items are still being negotiated. But today, I personally am totally focused on what's going to happen with the potential repeal of the Affordable Care Act and the negative impact that that would have on Medicare and Medicaid. And we just want to give the Republicans the opportunity to adhere and stand up with the president-elect to make sure that these programs do not get changed in ways that will harm millions of people across our country. Yes.
I'd just like to follow up on a previous question about the impact of tonight's late night proceedings. Can any of you comment at all on what the point of that is, given that there's going to be a vote-a-rama on Wednesday night? Why go late into the night tonight as well?
Go ahead,
Sure.
Chris.
I think the point is to send a clear message to the country and to the American people that, number one, we're going to do everything we can to prevent Senate Republicans from destroying the Affordable Care Act, to let Americans know that in addition to harming health care for 30 million people, which is outrageous in and of itself, the Affordable Care Act also included all these other provisions, including helping seniors on Medicare. It has also benefited dramatically people who are on employer-provided health care plans, because while we've had a lot of conversations about rising premiums in the Affordable Care Act exchanges, and those are issues I think we all agree that we should fix, but you don't fix them by destroying them. But while those premiums have gone up, the premiums in the employer-provided health care market, which is where most Americans get their health insurance, have been very low, historically speaking, since the enactment of the Affordable Care Act. All those tens of millions of Americans who somehow think that they're not going to be harmed by the repeal and destruction of the Affordable Care Act need to realize that they're benefiting from it. So we're focused on making sure that we get on the Senate floor and talk about the damaging consequences and the chaos that's going to be created throughout the healthcare system from this act.
And I would add that chaos and the concerns are already percolating all throughout our country, and any changes to Medicaid, for example, would have very negative impacts on rural health care centers, for example. And we should also remember that when the Republicans repeal the Affordable Care Act, they are not putting anything in its place. Nothing. It was supposed to be repealed and replaced, but we're just getting a repeal with all the negative consequences that the four of us have pointed out.
Last question.
Okay.
I guess just a follow-up, are you confident that some Republicans might back your amendment, especially those from states that expanded Medicaid under the Affordable?
Well, I hope we'll find some Republicans who will support the president-elect. Thank you.
Thank you.